Well, it turns out that if you see a random therapist and let's say you go to the doctor and he says, you need some therapy, and they write a little prescription and he scratches on a piece of paper, go see the physical therapist for 6 to 8 weeks and, do some passive and active movements. The most likely thing that's going to happen to you is you're going to go see the therapist and they're going to apply the type of therapy that they know how to do, which is usually therapy for traumatic brain injury or back pain. But it's very different than the types of therapies for the movement disorders, for that group of circuits in the brain that we call the basal ganglia. And so having specific training in physical therapy, occupational therapy, and speech therapy, and knowing how to attack the problem and understanding the underlying problem makes all the difference. And we've seen over and over cases where people have had a course of therapy and they said, I haven't gotten better. I said, well, wait a minute. Let's make sure you get the right therapy. And we either get them in with our therapists, or our therapists will write the plan for them, and they'll take that plan locally back to a therapist who might be a back pain or a spine therapist and be able to, put that plan into action. And then it really changes the life for that person. They say, this works. You say, well, it's just a little tweak. And what's nice about that is it also creates a nice relationship with the community, because then that therapist learns a little bit about the specific disease, whether it's Parkinson or dystonia or tremor or Tourette syndrome. And so it has a nice closed loop system, so it can help a lot of people.